understand, having low testosterone is
even worse.
It's dangerous, right?
So you're touching on an excellent point, Whitney. So let's talk about this, because this is an area of big confusion. So what is the area of big confusion? If you look at men and their testosterone levels, a lot of men at the age of 40, they start to have symptoms where they're starting to feel tired, they're starting to get more body fat, they're exercising and they're not seeing results. Their libido is changing, their sexual function is changing, they're starting to have problems, they're embarrassed to talk about it. And if you see how the medical field approaches them, the American College of Endocrinology stance on these patients is check their testosterone level. If the testosterone is above 300, it's not the testosterone, it's something else. They need to diet and exercise and everything's gonna be okay. Well, it doesn't work that way. Through the years, of course, when I was younger, I did exactly like what the experts do. Here's the whatever college of this, I follow. The college of this, I follow. The college of that, you follow. At some point, when you start treating a huge number of patients, more than most of these experts that put the guidelines, they know the studies, they know that, but you don't treat patients. They only see patients half a day a week. Most of these experts, realistically, for you to know, this is a fact. None of them is a physician, whether in endocrinology or cardiology or whatever ology, seeing 50 patients even a week. They don't do that. It's in the research and teaching and lecturing, and analyzing information.
But you're actually seeing the patients.
But I'm seeing these patients,
right?
And I'm following the guidelines that they're telling me to follow. But then you start looking, you have a man that comes to you and his testosterone is 240, and it's low. But this person, based on his receptors and the function that he has, he's perfectly fine. The guy's exercising, he has great muscles, he feels good, his libido is fine, sexual function is fine. Does this mean I have to give him testosterone? No. On the other hand, I can have a man, his testosterone is 700. So based on all the guidelines and the data and the American College of Endocrinology, he's perfect. It's not his testosterone. But the man has every symptom of low testosterone. He has low energy. He has, no motivation. His libido is dropping. His erections are not well maintained. Even if he takes a Cialis or a Viagra, he's still having problems. So this man, you treat him with testosterone, you adjust his level. It could be to 1100, 1200, the top level of normal. All of a sudden, he's back feeling great, and he feels the happiest man in the world. And this poor guy could be running between many doctors who tell him, "Oh, you have no problem. You need to see a psychiatrist." So this is the variability in treating men.
So that's interesting. So there's such a wide range of what normal is for
Correct.
testosterone.
Absolutely.
Because the range is what, 300?
Yes, so it can vary like from
1200?
250 to 1100. So you're bringing an excellent point.
Right.
I appreciate your knowledge in that, because that is the dramatic difference. So a man who's used to be probably on that top 1100, when he starts to get down to the 600-700s, and everybody keeps telling him you're great, no, for his body he's not great.
Right.
Now he's functioning at a different level, and he feels that effect. And then you can have somebody genetically, he always lived with a 300, so when he drops from 300 to 280, he's still feeling fantastic.
Right.
So diet and exercise and everything fantastic that you can do might adjust your testosterone, total testosterone, so we can keep the language simple, by 50 points, 80 points, maybe 100 points, but there's nothing that's gonna take someone's testosterone from like 300-400 to all of a sudden 700-800 just because he changed his diet and exercise and lost weight. So realistically, if you have somebody that's just became inactive, gained weight, etc., eating bad, fast food, yes, their testosterone can drop, a couple of 100 points or 150 points. And if he reverses this, he might be able to get them back and we're done. But when the change of life, the andropause, we men go through a change of life, but it's much more soft compared to women. Women have an abrupt change in their hormones, so they know they have a problem. Mm-hmm. Suddenly the period stops, severe hot flashes, mood swings, lack of sleep, irritability, change in the well-being in life, it's immediately telling them there is a problem. So that's why they get attention. Men, it's a slow transition. It's a slow drop. So it takes you 2 or 3 years to feel, is there something wrong? My body's changing. So during that phase, you can fight for a year, for 2, by pushing more exercise, improving diet, reducing saturated fat, eating more healthy proteins. These are all factors that will improve your testosterone. But at some point, still that's not going to solve the problem. You're going to get to a point that you feel, I have to make a decision.
Right.
Either follow Mother Nature's plan, which is slow decline every year, or try to do something about it and try to balance your hormones under a good medical supervision and still be safe and feel good.